paid program. WFEA is not responsible and accepts no liability for any of its content. The opinions, views, and advice expressed during the show are solely those of its participants and not those of WFEA, its advertisers, or management, and should be used as such, as every individual situation is different.
It's time for On Call with Minuteman Health, bringing you an hour discussion with New Hampshire physicians and healthcare experts on topics ranging from specific medical conditions to our changing medical system. On Call with Minuteman Health, helping you understand healthcare. And now, here's your host, Scott Colby.
Good morning, folks, and welcome to On Call with Minuteman Health. I'm your host, Scott Colby, and happy Wednesday. Another beautiful day on tap, although I would like to see a little bit of rain to help the gardens. In the studio with me this morning is Dr. Jessica Ryan of the Elliot Breast Health Center at River's Edge. Good morning, Dr. Ryan, and welcome to the show.
Good morning. Thank you for having me.
Oh, it's awesome to have you here. It really is. So, Dr. Ryan, we've done a couple shows since we began airing a couple years ago on breast health and breast cancer, but we're going to take this important topic today with your help, and we're going to bring it to a different place. And so today's show is Surviving and Thriving Breast Cancer. So let me introduce you to our listeners, and then we can jump right in.
Great, thank you.
All right. So Dr. Jessica Ryan completed medical school at Upstate Medical University in Syracuse, New York. She completed her residency at Tufts Medical Center in Boston. She is fellowship trained, at the University of Southern California in breast surgical oncology. She's board certified in general surgery, and once again, she is a breast surgeon at the Elliot Breast Health Center at River's Edge here in Manchester. So, Dr. Ryan, that was a lot. Did I get it right?
You did, absolutely.
Other than stumbling over a couple of things.
No, that was perfect.
Well, it's hard. You got to get going in the morning.
Thank you.
So what I'd like to do is I'd like to bring our listeners, men and women, through a brief journey of the importance of diagnostics. And we've covered this in the past, but let's do this as a refresher, and then walk our listeners through what happens when the mammogram, the screening mammogram, comes back remarkable or positive. Mm-hmm. So diagnostics, if you could, please.
Mm-hmm. So I think one of the most important topics is mammography, mm-hmm. And its vital role in screening for breast cancer. And there has been a lot in the media, a lot of discussion about who and when and how often.
Yep, there is some controversy.
Yeah, so, but really, my takeaway point from it all is that it remains a very important role in screening for breast cancer and hopefully finding it at a point that is early and treatable and curable. We recommend mammography annually, mm-hmm. once a year, for women starting at the age of 40. Mm-hmm. Sometimes earlier, if they do have a significant family history.
Is that the primary risk factor that would drive
change?
that?
Yes, yeah. For the most part. Mm-hmm.
Okay. And Dr. Ryan, what do you mean by a family history? Mm-hmm. Are we talking, a great-great-grandmother? No, of course not. I'm being a little flip, but who? Immediate family?
So it's first-degree relatives, a mom, a sister, mm-hmm. That raises our eyebrows the most. Okay. An aggressive cancer, or one that was diagnosed at an early age, or premenopausal. Those are all things that alert us to a potential genetic mutation, mm-hmm. or a significant family history.
And when that is present, a woman would be screened
a little differently. Yeah. And so the other question comes up is when is an MRI indicated? Yep. And very basically, we use a risk of about 20%. So if we calculate all things and your lifetime risk is about 20% of breast cancer, that's significant. And that's where we start to talk about supplementing, not mm-hmm. replacing, but supplementing your screening program with an MRI as well.
So, Dr. Ryan, I suspect that the science is still evolving and is not quite as mature for breast cancer and men. Mm-hmm. But if a male has a first-degree relative who is also a male, mm-hmm.
that
contracted breast cancer, does that put him at higher risk?
Correct.
Or don't we know yet?
No, so another one of those eyebrow raisers I was alluding to. So diagnosis of breast cancer at a young age, an aggressive form, diagnosed in a male family member, as well as the diagnosis of ovarian cancer. These are all things that can increase your risk and warrants a genetic counseling session to really get a sense of your overall risk.
So just to be clear, because I'm a little slow, so if a first-degree relative is a male, and that first-degree relative does contracts breast cancer, does that mean that the first-degree women and first-degree men should be screened, or just the first-degree women? Does that make sense?
Yeah, so really the entire family needs to be assessed for their overall risk, and it should really start with the family member who was diagnosed. So that's really where the testing should begin, and that gives us the most information to be able to then relay to other members of the family to direct when they should start their screening.
Great. And where I'm going with this, Dr. Ryan, is I don't want people to think that, a male in the family had breast cancer and that's just a fluke and everybody else can just kind of sail and coast and help that person through that journey. But no, it's not.
It's a very good question, because oftentimes men are uncomfortable discussing breast cancer. There's a kind of a stigma attached, and so it's important to really communicate that with your doctor and more than likely be directed towards genetic counseling.
Great. And so there are a couple other things aside from mammography or mammogram. What is the proper term, by the way? Is it mammography or mammogram, or doesn't it matter?
Mammography is more the tool. The mammogram is the actual film image that we look at.
Okay.
So you can use them interchangeably. Yes, I won't judge you.
Oh, great. It's a no judgment zone. Heather's hysterical right now. Thank you, Dr. Ryan. So there are other things that medicine recommends. Mammography is probably the most important for women, but also self-exam?
So there's another area of some debate. Yeah, so in 2008, there was a huge study done. It came out of Russia and China, and they suggested that self-exam was not valuable and maybe even led to unwarranted biopsies, et cetera. My argument, and many in our circle of breast specialists, stand by self-exam being valuable. And I think it's hard to argue that a woman being familiar with her body would not be beneficial in some way, because she can then detect a significant change.
Sure.
So we're all a little lumpy bumpy to some degree, and it's really just learning what your normal lumpy bumpy is, so that when you do your self-exam a few days after the end of your menstrual cycle, you can notice if something is different.
Right. Very good. And Dr. Ryan, we have about a minute before we cut away to break. And before we do, what are some of the things that a woman in particular, or a man for that matter, might notice that would be an indication that you really need to go see your PCP to begin looking? A discharge comes to mind. That's probably very common. Right?
Yeah. So yes, nipple discharge is pretty common. There are many normal, benign reasons to have nipple discharge.
Okay.
So clear, even green, that can all be more of a fibrocystic change that's leading to some decompression through the nipple. So usually it's unilateral, meaning nipple discharge on just one side.
Okay.
Maybe that's blood tinged. Those are things that we're more concerned about. But again, any lump or bump that feels different to you, any skin changes, any puckering or dimpling. If you're standing in front of the mirror, put your hands on your hips. If you notice that there's a kind of dimpling or a change in the shape of your breast when you move your arms, those are things that could potentially be a sign of something that needs to be investigated.
Great. Well, Dr. Ryan, it is time to cut away for break, and I'd like to invite the listeners to call in if they have any questions about breast cancer, breast health, or if they're survivors and would like to share a little bit of their story. 603-669-1370 is the number. We'll be right back.
People are finally doing something about the rising cost of their health insurance. They're switching to Minuteman Health. Minuteman Health could save you $1,000 to $5,100 a year on your premiums. Enroll at MinutemanHealth.org. Savings based on healthcare.gov comparison of the lowest cost 2016 silver plans for all carriers in 03215 for a family of 4, 2 adults age 40 and 2 children under 21, all non-smokers. Provider networks, benefits, and cost sharing amounts vary.
St. Joseph Hospital now gives you more room to relax inside our new wide-bore MRI, used to help diagnose possible injury or illness. Patients who might find conventional closed MRIs difficult to tolerate no longer have to sacrifice comfort for the quality of their images. St. Joseph Hospital's new MRI unit will provide you with a faster, quieter, and more comfortable MRI exam without that closed-in feeling. We offer appointments 7 days a week for added convenience, and we promise to provide your exam results as quickly as possible. Top quality imaging for precision diagnosis. Expert care in a stress-free, patient-friendly environment. The latest innovations and technologies. It's just what you'd expect from St. Joseph Hospital. To learn more about our new wide-bore MRI, visit us at stjosephhospital.com. That's stjosephhospital.com.
When your diagnosis includes the word cancer, you want your care to be the best possible. At New Hampshire Oncology Hematology, their mission is to provide expert and compassionate care for adults with cancer and blood diseases. Their providers are committed to their patients and their fight. All members of their staff value honesty, teamwork, and communication with patients, their families, and all members of the care team. You and your family will always be treated with dignity and respect at New Hampshire Oncology Hematology. To learn more about their cutting-edge care close to home, visit NHOH.com.
You're listening to On Call with Minuteman Health. This show is informational and not intended to be used as a way to diagnose or treat medical conditions or to replace an appointment with your medical provider. For immediate and medical attention, consult your primary care physician, call 911, or seek care at the nearest emergency department at a local hospital. And now back to On Call with Minuteman Health.
Good morning, folks, and welcome back to On Call with Minuteman Health. I'm your host, Scott Colby, and in the studio with me this morning is Dr. Jessica Ryan, breast surgeon at the Elliot Breast Health Center at River's Edge here in Manchester. Dr. Ryan, once again, thank you so much for joining us this morning.
Thank you.
So when we went away on break, we wrapped up the discussion of the mammography procedure, self-examination, and really the importance of screening and being aware of your body as it relates to breast cancer and today's topic, of course, surviving and thriving breast cancer. So let's move now to the point where the mammogram comes back and it's positive, remarkable, there's something there, it's bad, however you want to characterize it. Walk us through the journey that the patient undergoes.
Mm-hmm. So patients will know this as a callback, and they know that term because it immediately
you get stressed.
Right. Yeah. Fear, questions, anxiety, absolutely.
I've said this before on the show, Dr. Ryan, we all go to the worst place. I think it's human nature.
Absolutely. We go to the worst place. We go to Dr. Google. We find every
yes,
horrible thing that can happen. So we understand that, and so we do our best to expedite things so that a woman can get an answer. And hopefully alleviate her fear. So when we do see something on a mammogram, we, quote-unquote, call the patients back because we need to do more. The mammogram is switching from a screening tool to a diagnostic mammogram, meaning more focused, targeted views to help us answer our question, hey, that spot we see, is that real? Is that something we need to investigate, or is that okay? So a woman gets called back, and we do this diagnostic imaging. And if it indeed is something suspicious that warrants a tissue biopsy, our goal, particularly at the Elliot Breast Center, is to have a patient see a surgeon, see someone like myself, either then or as soon as possible before getting that biopsy. We like to meet them so that they have a person, they have a face. So that should this biopsy wind up being a positive result, and we do need to use the C word, then they've met our face and made that connection.
So Dr. Ryan, if you could, and I don't want to, certainly I don't want to paint the Elliot Breast Health Center into a corner with this. I just want to try to give the listeners sort of a frame of reference. So a woman goes in on Monday.
Yes.
And there is something detected on the mammogram. She leaves. She doesn't know that. When does she get the call back? When would she typically be seen, and when would that process start? Is it a week later, or is it really a matter of days?
It's closer to a matter of days.
Good.
It really is. And honestly, we do tend to triage things a little bit. So for instance, I saw a woman recently let's say she did come in on a Monday and felt a mass. We do have a policy in place where if a woman calls or a primary care physician calls and says, I have a breast problem, I think I have a lump, I have this, I have that, within 48 hours she will see me.
Great.
For a clinical breast exam so that I can give her my interpretation, set her up with imaging, and go from there.
Great.
So we do have that 48-hour policy in place.
And that's quick. It doesn't feel quick to the patient.
No, it doesn't.
But 48 hours is quick.
It is in our world. It is. So we try. Now, admittedly, if it was found on screening, it may be a few days before that finding is really read and interpreted.
Yep.
So it may be a week before we really get them back in to see me to get the diagnostic imaging done to further answer that question.
And once you're back in for diagnostic imaging, you guys are on it.
We're on it. We're all over it. So, for instance, this patient I'm alluding to, if I saw her on a Monday, we did the imaging immediately. My radiologist made special time to do her biopsy on a Tuesday. And from the time the biopsy is done, it takes about 48 hours for the pathologist to really do what they need to do, look at that tissue under a slide, do their test, and give us an answer. So we understand that there's a lot of anxiety. But I think the biggest help is that 48-hour policy that I'm alluding to, so they at least have a person that they feel connected with that can answer
Right, they've
questions.
already seen you.
Right.
So that if the
Correct.
pathology comes back with the worst, possible diagnosis we want,
Mm-hmm.
they've already seen you. There's already that clinical relationship established.
It's not a stranger calling them on the
Exactly.
phone. Right.
And would
It
you,
helps.
Dr. Ryan, would you actually be delivering those results to the patient? Would one of your staff members?
I do.
You do it yourself?
I do it myself.
And do you typically do that in person, over the phone?
It depends on the patient, and I ask her when I meet her, him or her. When we meet, I say, would you like to come back into the office to discuss this, or may I call you as soon as it's ready, as soon as I have the answer, with the understanding that you'll also come in and see me.
Okay.
So regardless, they're coming back to see me.
Sure.
And I like to see them back, even if it's a benign, just to check in with them, make sure they're comfortable. I've answered their questions. They don't have any worries about the biopsy site. So it depends on the patient is my answer. But most will say, yes, call me as soon as you have the results, and then we'll schedule a time for me to come in and talk further.
And so if I'm putting the timeline together, realistically speaking, within a week, maybe a little bit longer, you're going to know whether that mass warranted biopsy, if it did warrant biopsy, whether it was positive for cancer or negative. Within a week, you will be having that discussion.
Yeah, I would say from the time we know that it needs a biopsy, that we're moving things forward.
So again, it moves rapidly. For the patient, it's an eternity. For the family members, it's an eternity.
It is.
But you move it forward. You bring somebody back in the office. You said that you give the patient the opportunity to have the results communicated by you over the phone or just in person, but you bring the patient back.
Absolutely,
right?
And encourage them to bring family members or a loved one with them.
Can you talk about why? We've talked about this before, but can you talk about why?
So as soon as I use the C word, cancer, sometimes it's hard to hear anything else over the sound of your own heart pounding. So having an extra set of ears is priceless. And sometimes, we have multiple visits to really understand the diagnosis, prognosis, and treatment options. So, yes, I very much encourage them to have family members with them.
And at this point, Dr. Ryan, and this is now getting into the angle of the show that we wanted to focus on. We're going to touch on some of the treatment options for cancer briefly. And as I mentioned, Dr. Ryan, for the regular listeners, we have gone down this road in detail before, so this will be a refresher for our regular listeners. But at this point, it would seem that something psychological happens typically to a patient, right?
Absolutely.
Can you talk about that?
So I call it a ticking time bomb.
Mm-hmm.
So as soon as I give them this diagnosis, they feel as though they have a ticking time bomb on their chest, and
mm-hmm.
they needed removed yesterday.
Right.
And I couldn't understand that more, and I think we all do. But it's my job, I think, in this time to really step back and say, breast cancer is not the death sentence that maybe it once was.
Mm-hmm.
Okay, so the experience that so many women went through 30 years ago, it doesn't have to be that now.
We had Dr. Feldman from your breast health center, from
mm-hmm.
the Elliot Breast Health Center, on a few months ago to talk about the advancements in diagnostics, and she said the same thing.
Mm-hmm.
It's not the death sentence that it
because
once
we're finding it for multiple reasons. We are getting, awareness is increased. We are finding it at an earlier stage. We do have better targeted chemotherapies,
mm-hmm.
immunotherapies, et cetera. So there are a lot of reasons that play into that. But my job is to really sit with the patient and help them sit back and say, okay, let's think about how this is going to affect my life and how I want to pursue treatments, or which treatments.
Mm-hmm.
Because we really, I think it's, getting back to that ticking time bomb, we really have to say, this cancer has actually been there for years. It's just now that we've been able to detect it. So we have time to sit together and think about what's right for you.
That's an important perspective, and I was wondering, maybe you could just take a minute, if you could, to delve into the science a little bit.
Mm-hmm.
Obviously, that's a true statement that the cancer has likely been there for years.
Mm-hmm.
I didn't realize that.
It's a little. I saw your face when I said that.
See? Listeners,
and
she's very good.
Patients will do the same thing, and they'll say, well, did they miss it on my mammogram last year? And I'll say, no. It really takes a long time for the cancer process to reach a point at which it exhibits itself in some way that we can detect.
Okay.
So I use that as, again, to kind of put the fire out and just say, okay, let's think about you. Let's think about, what you want, but also let me help you think about yourself in a year, in 2 years, in 5 years,
mm-hmm.
so that I'm thinking about you there and which treatments are beneficial.
And we're gonna go. We're gonna be coming up on break in a couple minutes, and when we come back, we're gonna go into a little bit more of that longer term journey, they're mm-hmm. surviving and thriving. But at the acute phase, where you're having the discussion with the patient and you're trying to bring them back down, and listeners, please understand, I say all of this with a tremendous amount of empathy and respect, and I know that there are listeners out there who are either battling or, a loved one who lost this battle. But you're going to try to ground the patient mm-hmm. so that you can put on your science hat, right, your medicine hat, and say, okay, the first thing we need to do is we need to battle this, mm-hmm. and here are your options for treatment. And the options for treatment, some have side effects that are very unpleasant, and some have minimal side effects. So could you just take us through some of the treatment options? And I know they vary, Dr. Ryan, mm-hmm. by the aggressiveness or the staging
right.
of the cancer, right? But just sort of the
right.
least invasive to the most.
Yeah, so, to treat breast cancer, we have surgery,
mm-hmm.
chemotherapy, radiation, endocrine or hormonal therapy. And which cancers need each component of that is obviously dependent on the type of cancer and its characteristics. But sometimes, say, a patient will need all of those things, potentially. The sequence or the order in which we offer those is also dependent on the type of cancer.
Yep.
So
we've learned a tremendous amount, haven't we, over the last 20 or 30 years?
We really have. And we have studies showing in some cancers, if they get the chemotherapy first and before their surgery, they do better. Okay. And that's a conversation I have to have when I'm talking about kind of putting out the fire, because everyone wants surgery immediately. And sometimes I really have to say, you know what, you're really going to do better if we do chemotherapy first.
Right.
But if you're asking to kind of break things down a little bit.
From the least invasive to the most.
Looking at surgery, you have breast conservation versus mastectomy, and we could talk about this all day. There's a lot of media showing that we've had a huge increase in the number of mastectomies being performed across the country. I call it the post-Angelina Jolie effect, but there's a little bit more of that, and I think
I actually forgot about that. But yeah.
So it has a lot to do with fear, I think.
Sure.
Really, sometimes maybe jumping to a mastectomy when it isn't, where the science would tell us that it's
not necessarily
helpful.
warranted.
Yeah.
Right.
So, but yeah, I think that's one of the first discussions I have is breast conservation or lumpectomy versus mastectomy.
Okay, great. Well, Dr. Ryan, we are up against break, and when we come back, let's finish our discussion about the treatment options. But I'd like to invite the listeners to call in. 603-669-1370 is the number. Dr. Jessica Ryan of the Elliot Breast Health Center at River's Edge is here this morning to discuss surviving and thriving breast cancer. We'll be right back.
We didn't start with the idea of a new facility, but as ideas evolved, they led to the Elliot at River's Edge.
Elliot Orthopedic Surgical Specialists is a group of highly skilled doctors.
We provide comprehensive diagnostic testing for sports injuries and other mishaps.
Whether we repair, replace, or reconstruct hips, shoulders, hands, or knees,
our doctors will diagnose and begin treatment plans right away.
I'm Dr. Mary Lee Soul.
I'm Dr. Jonathan Mack.
I'm Dr. Paul Scavetta.
I'm Dr. Martin Ross.
I'm Dr. Rob Parisian. Our complete orthopedic team is ready to treat you.
The Elliot at River's Edge is now home to the most advanced ambulatory health care in New Hampshire. It's also comforting to know that Elliot Surgical Specialists and the nationally acclaimed Elliot One Day Surgery Center are at the Elliot at River's Edge off Queen City Avenue. Elliot at River's Edge, we're ready to get you back to your active life. For more information, go to ElliotRiversEdge.com.
At Catholic Medical Center, we believe that excellence in healthcare and personal respect for our patients go hand in hand. From our primary care and laboratory services, the Mom's Place, to our minimally invasive robotic surgery, CMC meets your every healthcare need. Our expert specialists and caring medical staff are dedicated to being your lifelong partners in good health. CMC, leading the way with heart. Find out more at CatholicMedicalCenter.org.
When you have digestive problems, you need to turn to a gastroenterologist who listens and responds, an experienced doctor who knows the field and can effectively diagnose and treat your needs. New Hampshire Gastroenterology in Bedford is now opening a new office in Nashua. You'll receive the same superior and compassionate care from their dedicated team of trained gastroenterology professionals who give you the individualized care that you deserve. Call New Hampshire Gastroenterology today at 625-5744 or visit nhgastro.com for their 2 locations in Bedford or Nashua. You're listening to OnCall with Minuteman Health. This show is informational and not intended to be used as a way to diagnose or treat medical conditions or to replace an appointment with your medical provider. For immediate and medical attention, consult your primary care physician, call 911, or seek care at the nearest emergency department at a local hospital. And now back to OnCall with Minuteman Health.
Good morning, folks, and welcome back to On Call with Minuteman Health. I'm your host, Scott Colby, and in the studio with me this morning is Dr. Jessica Ryan of the Elliot Breast Health Center at River's Edge. Dr. Ryan is in this morning discussing surviving and thriving breast cancer, and once again, I would invite you to call in with any questions you might have about breast health, breast cancer, or if you have a story to share with us. 603-669-1370 is the number. So, Dr. Ryan, when we went on break, we were discussing the treatment options, and you had mentioned that there's a whole plethora of options available. There's chemotherapy, there's radiation therapy, there's hormone therapy, there's surgical intervention, there's radical surgery, there's conservative surgery. You talked about the radical surgery, but typically what I'm hearing from you is that the extent of the treatment is going to be driven by the type of cancer and when it is detected?
For the most part, the staging of the cancer, the type of tumor, whether it's receptor status. So again, we do our best to try to subcategorize and subtype and place these cancers into nice little neat boxes, and that I think it's useful because it helps us to direct patients toward different treatment algorithms. But at the end of the day, what I always tell patients is that no one is going to have your cancer. Yep. It originated from your DNA. This is yours, and so the plan that we ultimately decide on is yours.
Great.
And so.
Sound advice. Advice. So you've set up the patient now with a treatment plan. The patient is moving through the journey. and getting back to the psychological aspect of it and sort of the self-image and everything that the patient goes through, let's move into how you treat the whole person and what resources are available to help the patient and the family with the journey of surviving and thriving breast cancer.
So you're alluding to our survivorship care plans. And survivorship is a term that we throw around quite a bit, and it really means different things to different people. And some patients don't like to be called a survivor. They just don't want to be associated with the term, the cancer, et cetera. So I'm sensitive to that.
Yep.
But for
it's
the
sort of
most
like
part,
I had a cold and I got over it.
Yeah,
and
let's
next.
move on.
Yep.
But, getting back to how I said, cancer diagnosis, breast cancer diagnosis 30 years ago isn't what it is today. It's more of a chronic illness, meaning in some way, we're treating the woman up front, the treatments are done within 6 months or so, and then we really have to look at the rest of their life. How did our treatments affect their life financially? Did it interfere with their marriage? Did they go through a divorce? There are so many things that can happen.
I never thought of financially, Dr. Ryan. That's interesting.
Yeah. These wonderful chemotherapies I alluded to for certain cancers, they are expensive, even with the best insurance, even with, the best financial support. So there's a lot to think about after the immediate cancer treatment. And so when we do talk about survivorship, we have a lot of programs locally for patients. We have free massage therapy, free yoga sessions for patients. These are all things that can help them really focus on themselves, decrease their stress, anxiety, improve their sleep. All these things have been shown to impact their obviously their quality of life, but also their recurrence risk. Okay, and that gets into the importance of lifestyle modifications as a survivor.
So, Dr. Ryan, would you prescribe for a woman or a man, I guess, who is going through this treatment? Would you prescribe massage therapy? Would you prescribe yoga? Do you offer it at the Breast Health Center, or do you try to incorporate it in a more general population?
So it's offered to our survivors. Yep. We have at River's Edge, we have massage therapy through the Yoga Caps program. We can offer free sessions. I know we have it at least once a week at River's Edge, once down in Londonderry. So I'm not sure if that answers your question.
No, it does. It does. So it's basically it's available. It's not necessarily strictly for breast cancer survivors, but it's prescribed. Do I have that right?
No, these sessions are specifically
for breast.
They are specifically for breast cancer survivors.
Okay, very good, very good. And what other things would you incorporate into a survivorship care plan?
So diet and exercise, and I know everyone rolls their eyes. We've all heard it.
I love these topics, by the way. I really do, because we all have to be mindful.
Right. Fortunately, there has been more attention placed on the importance of exercise and diet and really decreasing your recurrence rate. So you have a woman who you've gotten through treatment. They may have side effects from their radiation. They can have side effects from any of the treatments, ranging from neuropathic pains, lymphedema or swelling, all of these cognitive changes we talked about, depression, anxiety. So many things can be going on that you can focus on, and it can be overwhelming. So I say, let's take one thing at a time.
Sure.
And so I think diet and exercise is something that is extremely important. And we have the Live Strong program, which offers breast cancer patients a free 12-week program.
That's great.
At the YMCA. So that really kind of helps them to jumpstart and get into a rhythm.
So, Dr. Ryan, I know you're not a registered dietitian and nutritional counselor, but I'm going to ask this question anyway, and it's not really to blindside you. It's just a quick question that popped into my head. So let's say you have someone who is a a breast cancer patient and you're putting together a survivorship care plan, and the woman happens to be significantly overweight. Mm-hmm. With the diet modification, are you looking for healthier choices being the most important, or weight reduction being the most important? In other words, if somebody wants to eat and they don't really want to lose weight because it seems like a chore, mm-hmm. are you just trying to coach them toward more healthy alternatives?
Well, I would argue that if you do it right, you can have both. But I understand.
I would agree.
I understand where you're.
Where I'm coming from is, mm-hmm. I'm going through all this as a breast cancer survivor or a patient going through the acute phase. Mm-hmm. The last thing I want to worry about is sacrificing the calories and feeling hungry all the time. If I want to eat, I want to eat.
Mm-hmm. No, I understand. It gets back to quality of life and enjoying your life. But I hope that we can try to entice women that they can have both, that they can be happy, they can find healthy foods that are, they're good for them, and still lose weight. And it really, you do need both. I would argue that diet is more important, but you really do need diet and exercise. And we have studies showing that women who say they're sedentary or they don't have much activity prior to their cancer diagnosis, if they increase their activity after diagnosis, that has a strong protective effect.
Interesting.
So there's data there. It's not just doctors saying, go out and run and eat an apple a day. We know that it's hard. It's hard for someone without a cancer diagnosis and all its side effects to implement an exercise and diet regimen. We understand it's hard for me. I don't have breast cancer. So we understand that it's hard to incorporate into our lives, but we hope we can give them some motivation to try.
So on the exercise piece, are you finding, anecdotally, that the patients who present with breast cancer are already people who are exercising? If they don't, you're shaking your head no. And if they're not, do you find that they do adopt an exercise routine, whether that be, you don't have to go run marathons, but whether it be just walking maybe a mile a day?
We hope so. We encourage it. I know our medical oncology colleagues, so they're the doctors who are in charge of, for instance, chemotherapies. They're going to encourage an active lifestyle even throughout chemotherapy, again, because we do have evidence that it's going to attenuate some of the side effects and ultimately make it a better experience for you.
Right. Sleep. You mentioned the importance of massage and yoga to help, overall mental health and relax and sleep.
Yeah, so yoga isn't for everyone. But
no, it's not. I don't like it.
Yeah, and massage is not for everyone
I've never had one.
So, it's all about trying things, and I think just making yourself a priority.
Yeah.
Okay. I ask all my women, who's the most important person in your life? And they list their spouse and their kids and et cetera and et cetera. They're always dead last on that list. And I really have to encourage them to make themselves the priority. And then you'll see that when they're able to do that, that's when they find encouragement by going to things like yoga or, being proud of how they're incorporating some of these tactics and regimens into their life. So it's hard. Right. I'm not going to discount that.
It is. Well, Dr. Ryan, we are up against break. I'd like to invite the listeners once again to call in. Dr. Jessica Ryan of the Elliot Breast Health Center at River's Edge is in this morning discussing surviving and thriving breast cancer. 603-669-1370 is the number. Again, 603-669-1370. We'll be right back.
People are finally doing something about the rising cost of their health insurance. They're switching to Minuteman Health. Minuteman Health could save you $1,000 to $5,100 a year on your premiums. Enroll at MinutemanHealth.org. Savings based on healthcare.gov comparison of the lowest cost 2016 silver plans for all carriers in 03215 for a family of 4, 2 adults age 40 and 2 children under 21, all non-smokers. Provider networks, benefits, and cost-sharing amounts vary.
At Catholic Medical Center, we believe that excellence in healthcare and personal respect for our patients go hand in hand. From our primary care and laboratory services, the Mom's Place, to our minimally invasive robotic surgery, CMC meets your every healthcare need. Our expert specialists and caring medical staff are dedicated to being your lifelong partners in good health. CMC, leading the way with heart. Find out more at CatholicMedicalCenter.org.
We didn't start with the idea of a new facility, but as ideas evolved, they led to the Elliot at River's Edge.
I'm Dr. Joe Guanascia. There was a lot of talk about this being the right time for urgent care.
It's a perfect choice to treat illnesses, accidents, or injuries, or when your doctor's office is closed. I'm Dr. Kevin Rankins.
No one wants to take up time in an emergency room when others might need that time for life-threatening injuries.
Urgent care quickly gets you to a board-certified emergency doctor.
These days, making urgent care easily available and accessible means health care is less expensive for all of us.
Urgent care is a great option when you don't need an emergency room visit. I'm Joanne Waska-Cormier, LPN.
Urgent care at the Elliot at River's Edge. It's faster than an emergency room visit.
You're going to love our care.
Urgent care is open from 7 a.m. to 10 p.m. every day. No appointments necessary. Located right off Queen City Avenue at the Elliot at River's Edge. For more information, go to ElliotRiversEdge.com.
You're listening to On Call with Minuteman Health. This show is informational and not intended to be used as a way to diagnose or treat medical conditions or to replace an appointment with your medical provider. For immediate and medical attention, consult your primary care physician, call 911, or seek care at the nearest emergency department at a local hospital. And now back to On Call with Minuteman Health.
Good morning, folks, and welcome back to On Call with Minuteman Health. I'm your host, Scott Colby, and in the studio with me this morning is Dr. Jessica Ryan of the Elliot Breast Health Center at River's Edge. Good morning once again, Dr. Ryan.
Good morning. You're getting very good at that introduction.
Do you like that?
Yes, it's great.
It kind of ramps up. Mm-hmm. You know, by the end of the show, I'm like all over it. If we did this constantly, it would be, you know, I could do it with my eyes closed. So, yeah. Well, again, thank you so much for being here this morning. This is our last segment. It goes very, very fast. And you were here to talk about surviving and thriving breast cancer. 603-669-1370 is the number. So when we went on break, we had wrapped up our discussion of the components of the survivorship care plans that your breast health center, the Elliot Breast Health Center, pulls together for the cancer patients. And that the components include diet, exercise, weight loss, sleep, mental health, self-awareness. What would you say? Of course, these plans are unique to the individual. As you said, nobody has your cancer, right? Nobody has your body or your lifestyle. They vary. How is the compliance, and who is it at the Elliot Breast Health Center that keeps people on track and accountable to that plan?
Yeah, so that's difficult, and a very good question. Again, survivorship it's for the duration of the woman's life. So this is it's something that it never stops.
Okay.
So in our practice and in most practices, we see our patients every year. Okay, so if you're diagnosed with cancer this year, I'm going to see every year for the rest of your life. When you come in for your mammogram or clinical breast exam, et cetera, we're going to see you and ask how are things going, and maybe try to get a feel for your compliance, as you're alluding to. But it's hard.
Yeah.
You know, it's a one-time visit. We're not with you. You know,
you're not parents.
When you're out there, when you're faced with the difficult diet choices, et cetera. So but it is enough. I think it's not just about diet and exercise. It's just about really hearing and being open to what your patient is experiencing. So maybe it's 10 years out and she happens to mention that she's having pain near her surgery site where the radiation was, et cetera. And likely it's a neuropathic pain, but you don't have to live with that. And we've heard patients say, again, I keep alluding to 30 years ago, the bad old days, if you will. But, you know, it used to be, well, that's the price you pay for getting to live. This is the side effect you're stuck with. It's true.
That's a tough love.
But that's not how it should be. And so I think even, you know, our visits, as you say, checking in on their compliance and how they're doing, it's also just, is there something new that's bothering you that we can help with? And I think just by identifying it and communicating with the patient about it, it just helps them feel like someone's listening to them.
Right. Right. So there are some other tools or programs that help patients thrive with breast cancer, and the listeners will know that prior to every show, I do meet with a guest, and we get to know one another, and we just talk and understand a little bit about each other. And I was discussing my children, and I mentioned to you that my 21-year-old daughter is currently pursuing a bachelor's. She has a associate's degree as a certified occupational therapy assistant, and she's pursuing a bachelor's degree in art therapy. And you said art therapy.
Yes, I got excited.
Exactly, and you got all excited. So why don't you tell the listeners why you got so excited about Caitlin's journey in pursuit of an art therapy degree?
Yeah, so we have an art therapy project for our breast cancer survivors that we're developing, and actually we're just kind of opening registration now.
Okay.
But it's art therapy can be so many things.
Sure.
It encompasses all kinds of projects and elements. But in this case, we're calling it the Bra La La Boutique of Bravery. And it's basically where we get women together at all phases of their survivorship. And we get them together and we decorate a bra. Each of them decorates a bra. And it's meant to reflect their journey through their diagnosis. And it's amazing to see many of these women don't know each other, but they do have one commonality that connects them all, and it's amazing to see that connection that they can make, and the creativity that comes out of it. And I'll give you an example because I'm sure listeners are thinking, what is she talking about?
Yeah, right.
What are they doing with these bras? So, for instance, one woman decorated the outside of her bra with bright, beautiful colors and flowers and a happy face. And then on the inside, she painted it black. And that represented, she said, on the outside, everyone thought I was doing great. I was strong, I was brave, everyone just thought I was doing great. But on the inside, I was angry. I was scared and I was angry. And that's what it represented to her. And I love that. I think the power of being able to express yourself and share it with other women who have experienced cancer in maybe a very different way than you did, I think that's a powerful thing. Being
mindful of HIPAA and the journey that individual patients may take, do you find, Dr. Ryan, that some of these issues are sort of breakthrough moments for the patients, and it brings them to a different place? So maybe somebody who is finally able to verbalize anger, frustration, fear, is then able to get the appropriate counseling they need to bring them the rest of the way. Is that what happens, or do you think that the art therapy serves that purpose in and of itself?
Yeah, so I think it serves a different purpose for each woman. It does.
Right.
It may just be needing to feel that sense of community, but as you said, it could be that something that makes them have a aha moment that somehow allows them to recognize that they've been hiding fear and anger and are now able to address it. So it's difficult, and I wish decorating a bra could fix the world, could fix everything, and I know that it won't, but it's a start. It's something. I think it's bringing.
It's an expression. I mean, it really is, right? It pulls it out.
We want to make it a celebration. We want it to reflect success. Okay, so even the little successes, getting back to that darn dieting that we were talking about.
Yep.
So even the little successes, we want them to feel like they can celebrate that they're worth it, that they should celebrate. So.
Yeah. And there are going to be, part of the survivorship care plan, it would seem, is helping the patient recognize that this is a journey, right? That it is a lifelong journey, and that there are going to be times when you feel like you're on top of this and it's fine, and there are going to be times when you're just reminded of this and it brings you right back.
Ups and downs.
Can you talk a little bit more about the ups and downs and strategies that patients really need to think in terms of to manage those?
So I think first knowing that it's going to happen.
Okay.
And I've seen very strong women and they won't cry and they sit in front of me, I say that it's okay if you go home after this and fall apart and cry.
Mm-hmm.
That's okay. Let it happen. You are going to have these ups and downs. I think first and foremost, just know that it can happen. Know that it's okay. And find, the next step is finding ways to kind of bring yourself back up. Mm-hmm. And that's going to be a different activity for each person. We learned today that it would not be massage for you.
It would not be.
But again, each journey is, it's special to each woman.
Right.
So I don't know if that answers your question.
No, it definitely does. I mean, I think that's really important, is preparing them that way to know that it is in fact a journey. And the goal, of course, right? And you said this when we met, is living life being strong, right? Mm-hmm. Is really what you said the goal was. Mm-hmm. At the beginning of the show, we talked about the clinical aspect of the diagnosis of cancer, and we talked about some of the treatment options. And when you and I met, we also talked about the hidden scar procedure. Mm-hmm. And we have just a couple minutes left. And when we were on break, we were like, well, maybe we should have talked about that earlier in the show. Mm-hmm. But I'm thinking actually this is really a good place, Dr. Ryan, because there are going to be triggers for a woman mm-hmm. that bring her right back to breast cancer.
Yeah.
And one of those could be a scar.
Mm-hmm.
So could you talk about the advancements in surgical site?
Absolutely. So our focus in surgery, of course, number one is to get that cancer out.
Absolutely.
But number two, we want to leave a woman with a cosmetic result that is acceptable. We mm-hmm. don't want to leave her with a deformity that leaves her thinking about cancer every morning, every time she gets dressed and looks in the mirror. So we do have a hidden scar program, which the focus is being able to place scars that are much less visible. So that is kind of under the breast, where mm-hmm. near where your underwire would run, out towards your axilla or armpit, around the areola, which is the darker skin, kind of right on that border of dark mm-hmm. and light. It can help us to hide that scar. Oncoplastic techniques to fill in any volume.
What is oncoplastic?
Oncoplastic is kind of the term that we use that combines removing the cancer and also using plastic surgery techniques to reshape the breast and, again, leave the breast as close to as we found it as possible.
Sure.
Again, it just gets back to thinking about the woman not just at the time of her diagnosis, but a year later, 5 years later, 10 years later. What is going to help her to feel whole or feel like herself?
Right. Because, again, it is a journey. A woman can expect to sort of fall back, right, psychologically.
Mm-hmm.
And if these scars are really prevalent, that's
mm-hmm.
going to just be in your face,
Yep.
right?
Yep.
Very good.
Mm-hmm.
Well, Dr. Ryan, I hear the music in the background, and I want to thank you so much for coming in today to talk about breast cancer, surviving and thriving breast cancer. So thanks again.
Thank you so much. It's my pleasure.
Folks, Dr. Jessica Ryan of the Elliot Breast Health Center at River's Edge has been in this morning discussing breast cancer. Thanks so much for tuning in. Make it a great week.